Dry eyes is probably the most common complaint we hear in an ophthalmology office. And a lot of people mistake it for tired eyes or blurry eyes. A lot of people come in with complaints of tearing. So understanding dry eyes is important. It's almost endemic in the postmenopausal female population. And it's really something that can create depression, create anxiety, render people unable or have difficulties performing their jobs, looking at computers, reading for prolonged periods of time. And essentially, dry eyes is a little bit of a misnomer. What ends up happening is the quality of the tears is not good enough. They don't seem to stick to the eye. The volume of tears is not quite what it needs to be. So the cornea ends up with some patches that are wet, some patches that are dry, and that creates blur vision. There's images being created by those dry spots and those wet spots, so people can present with blur vision. Other people present with feelings of being tired. After looking at the computer, the eyes get tired because they're not well lubricated. Other people come in stating that the eyes tear all the time. And the way that happens is, once the eye is dry enough and gets irritated, the big lacrimal gland says, oh, something's going on here, and starts producing massive amounts of tears that just proceed to run down your cheek. So understanding dry eyes for patients is important. Understanding there are solutions for the treatment of dry eyes is also important. And the solutions basically can be divided into two. We can use now medications that promote the formation of better tears, or we can actually decrease the amount of tears that leave your eye if you have tried artificial tears or tear replacements and that has not helped.